I'm Dr. Christopher Rothman, and we frequently get questions about wisdom teeth and do they need to be removed. And so today we're going to try to address some of the most common questions regarding wisdom teeth. First one is, do I need to get them removed? In the vast majority of cases, the answer is yes. Over 90% of the people have at least one impacted wisdom tooth. And that is the main cause, a reason why we take out wisdom teeth. Other reasons could be they could have cyst, pathology, or damage the adjacent teeth, or cause crowding, especially after you've had orthodontics already performed. The other question is, do you have to have them all done at one time? And the answer is no. However, in most cases, it makes more sense to do it. You hurt once rather than twice. You only have anesthesia, although it's very safe, once rather than multiple times. And actually, it will save you money in the long run by doing it in one procedure rather than multiple procedures. Another question we get asked frequently is, at what age should we get wisdom teeth removed? And the answer is it depends. We usually like to do it when teeth are 1/3 to 2/3 complete in root development. And that is usually between the ages of 14 and 18 in most children. However, as they age, the roots will continue to develop, and they're more likely to be into the sinus cavities or close to or touching a nerve. That's why I like to do it when you're younger. It just decreases the risk of complications, and also when people are younger, they heal quicker and bounce back from the surgery more rapidly. Some other questions we get asked frequently are, how long will the procedure take, and what about the recovery? Surgery typically takes less than 45 minutes after the IV gets started and we begin sedation. As far as the recovery, the worst days are usually days 2 to 3 post-operatively. The 48 to 72 hour window is typically when swelling peaks. At that time, you're usually the most uncomfortable. Following that, as the swelling starts to decrease, people start to feel better. Usually a week out, you're still swollen and sore, but you're getting better and better every day. And usually about 2 weeks out, you might have a little bit of discomfort after you're eating a hamburger, eating a steak, having pizza, something like that. One major concern people have, and we get asked about, is dry sockets. What are they? How do they prevent them, and how common are they? First of all, they're not very common. Around 3% of the population gets them after extractions. The main reason for them are age, over 24, smoking, as well as birth control pills. The other things we recommend not to do is spit or drink through a straw, because you don't want to create any sort of suction that would actually cause the blood clot to come out. Because all a dry socket is when you remove the tooth, you have a blood clot that fills in the socket. If you lose that blood clot, you have exposed bone, and it's painful. What about diet? What should I eat after surgery? My favorite things to eat after surgery, I recommend, are mashed potatoes and applesauce, because you're going to be numb after we finish up. So we don't want you burning your mouth, chewing up your lip or your tongue. So I like to start with those. They're both good foundations for your medications afterwards. And then once you start to get feeling back in your lip and tongue later on that day or evening, you can go to warmer foods and harder foods such as spaghetti, scrambled eggs, pancakes, oatmeal, grits, baked fish, mac and cheese. Those are going to be the type of foods you're probably going to be happier with for several days. However, once you get feeling back, you can advance your diet as tolerated. If you overdo it, you're going to regret it for a few days. Can I keep my wisdom teeth after surgery? And the answer to that is yes. As long as you let us know ahead of time before we dispose them, we're happy to give them to you. Also, people want to know how they're going to act after surgery. And the short answer is we don't know. The vast majority of the people wake up just a little bit sleepy, feel pretty good. But however, people are anxious, sometimes can wake up emotional and teary-eyed. Sometimes people can be a little cantankerous and ornery. It just really depends. We have noticed that once people turn on a video camera, they start to act a little crazier than they did beforehand though. Hey, we always love hearing from you guys, and we love seeing your funny videos. So if you want to, be sure to use the hashtag right here down below, and that way we can find them and we'll share them, and we will pick periodic winners to give you some prizes.